Welcome to the Nicole Chenard Show, where we reclaim the body as a portal to power. And remember that nourishment is how we lead, heal, and rise. I'm Nicole Chenard, dietitian, performance coach, and speaker. I'm here to translate what's going on in the world of health, nutrition, food politics, and human behavior. Today's episode is about alignment, the overlooked link between IBS, digestion, and nerve compression. If you've ever been told that your IBS is just stress or just in your head, or that your digestive symptoms don't make sense because your labs are normal or that it's all in your head, this episode is for you. Because today I want to talk about something that is rarely discussed in conventional digestive care, yet shows up again and again in real bodies. The connection between your gut and your spine, specifically how spinal nerve compression or dysfunction can drive digestive symptoms like IBS, bloating, constipation, diarrhea, reflux, or that constant feeling that your gut just won't settle. And no, this isn't woo. This is anatomy. This is neurology. This is physiology. It is not all in your head, not at all. Why this conversation matters. I work with high performers, executives, operators, athletes, people who do not lack discipline or resilience, and yet many of them struggle with persistent digestive issues. Despite eating well, supplementing, eliminating foods, and doing everything right. What I've learned in over 15 plus years of clinical practice is this: you can't out diet a nervous system problem. And digestion is one of the first places the nervous system speaks when something is off. It's a communication system. Your gut is not just a tube, it's wired with nerves that communicate. Let's start with something fundamental that people almost never hear. Your digestive organs do not operate independently. They are directly innervated by your spinal nerves and your autonomic nervous system. That means the stomach, the small intestine, the colon, the rectum. They all rely on clear, accurate nerve signaling from the brain and the spinal cord to function properly. If those signals are distorted, compressed, or chronically irritated, digestion changes, motility changes, secretion changes, pain perception changes, and suddenly you're labeled with IBS. The spine gut map, this is key. This is where it gets interesting. I borrowed this spine from an amazing chiropractor. How great is this? I wanted to really show you where this all happens. It would be nice if the organs were attached too, but they're not. So bear with me. Okay, so the different sections of your spine communicate with different parts of your digestive system. So upper thoracic spine is sort of over here. So that's behind your lungs and your heart as another reference. Upper thoracic spine, T5 to T9. I'm not being exact with the pointing, but you get the picture. T5 to T9, stomach, liver, and gallbladder. They're communicating. So if any of these are off, we're going to have trouble with stomach function, liver function, gallbladder function, which are all super important for digestion and detox and processing emotion. Mid to lower thoracic, T9 to T12. Again, I'm not pointing exactly, but lower. Those connect to small intestine and lumbar spine, so the lower back. Who doesn't know someone with lower back pain? Lower back. Lumbar spine, L1 to L3, communicates with the colon. Okay. Sacral nerves, even lower, S2 to S4. These communicate with the rectum, the pelvic floor, and bowel evacuation, allowing you to have a bowel movement completely. So if any of these regions are compressed, restricted, inflamed, or chronically braced, like you're not breathing a full breath, your gut may not receive clean instructions in this communication system. And your symptoms may not be random at all or diet related at all. How nerve compression shows up as IBS. Let's talk mechanisms because this matters. When spinal nerves are irritated or compressed, several things can happen. Altered motility, signals that regulate peristalsis, so the movement of the food, the rhythmic contraction that moves food through your gut can become erratic. This can look like diarrhea, constipation, alternating IBS patterns. So diarrhea, constipation, incomplete evacuation, meaning you go to have a bowel movement and some of it comes out, but you can feel the rest has not come out. So that can be really frustrating because it gets stuck and then you have toxins building up in your system. And number 2 is increased visceral sensitivity. Compressed or irritated nerves in the spine can amplify pain signals. So even normal gas or digestion feels painful, urgent, or alarming if those nerves are compressed. This is why some people with IBS experience intense discomfort with no structural disease. So if you're one of those people or you know someone who has done every conventional medical test with conventional medical doctors and they say, you're fine, we didn't find anything, but you feel that, you're not just making it up. It has to do with the structural components of the spine and that messaging. Number 3 is autonomic nervous system dysregulation. The opposite of fight and flight is you're resting and digesting. Your digestion depends heavily on the parasympathetic nervous system, the rest and digest state of being. Chronic spinal tension, poor posture, looking at your phone like this. That's an example of literally everybody. Old injuries or stress patterns can keep you locked in sympathetic dominance. That's the fight or flight nervous system. Shallow breathing, constant vigilance. And digestion simply does not thrive there because it needs to be in the parasympathetic nervous system state. This is why stress affects IBS, but not the way you think. Stress doesn't cause IBS because you're weak or you're anxious. Stress affects IBS because it changes muscle tone, breathing mechanics, and spinal loading. Think about it. Tight jaw, braced diaphragm, the muscle right underneath your rib cage, rigid thoracic spine, so the spine around your rib cage, that area, gripping through the low back and the pelvis area, your hips. All of this changes nerve input, the communication system. So yes, stress matters, but not as a mindset issue, as a neuromuscular one. Common clues, this might be your missing link. Here are some signs your digestive symptoms might be spine or nerve related. IBS that doesn't respond to food elimination, symptoms that flare when sitting, driving, or long work days, digestive changes after an injury, pregnancy, or intense training, low back pain, and bowel issues. Remember, they're very connected with these nerves. Pelvic floor tension, tailbone pain, or hip dysfunction, symptoms that improve with movement, body work, or breath work. These are not coincidences, these are patterns. And why traditional care often misses this? Most GI care focuses on food, bacteria, inflammation, and medication. Very little time is spent assessing posture, spinal mobility, breathing, nervous system tone, old injuries or surgeries. So people end up managing symptoms instead of restoring signal clarity. What actually helps beyond diet, and I know you can't believe I'm saying this because I'm a dietitian and I'm saying it's not diet, but it affects how you digest and metabolize. Now, this is not me saying food doesn't matter. It absolutely does. But for many people, food is the amplifier, not the root. What often makes a difference is addressing spinal mobility, especially thoracic. So again, the breathing area and sacral regions, thoracic, sacral, diaphragmatic breathing, vagus nerve tone, pelvic floor coordination, nervous system safety. This might look like targeted physical therapy or chiropractic care, or both, somatic work, breath work, strength training done well, paying attention to your structure and your breathing, that's so key, and learning to release chronic bracing patterns. Not more restriction, not more supplements, more signal integrity. A reframe I want you to sit with, here's the reframe I offer my clients. Your gut is not broken. Your body is not betraying you. Your symptoms are intelligent signals. They're telling you something about how your system is organized. When you listen at the right level, neurological, structural, embodied, things start to change, often faster than you expect. If you've been stuck in a loop of IBS mismanagement, I want you to hear this clearly. There may be nothing wrong with your digestive system itself. Your gut may simply be responding to distorted upstream information. And when that information clears, digestion often follows. I thought for so long that I had some kind of digestive issue every time, because sometimes you get backed up and you don't understand why. What did I eat is usually the first question. And every time I go to the chiropractor, there's an adjustment, the signaling returns, and relief follows very soon after. Don't underestimate this. It's incredible. It happens almost instantaneously because that connection has been restored. So, if you're looking for better digestion, and if this episode resonated, share it with someone who's been told it's just stress, it's just in your head, and left without answers. And if you want to explore this work more deeply, through nutrition, nervous system regulation, and embodied performance, you know where to find me. Until next time, listen to your body. It's wiser than we give it credit for. Also, hit subscribe so you're part of the movement, and drop a fire emoji in the comments if you're reclaiming your own alignment. Until next time, feed your power, not your programming. Thank you for listening. For more information about me and what I do, head over to NicoleChenard.com and follow me on Instagram at Nicole.Chenard. Thank you.